Welcome to another episode of the Your Longevity Blueprint podcast. Today I have Dr. Paulvin. The goal with his patients is to optimize their health in the first 60-minute visit. He's board certified in family medicine, anti-aging and regenerative medicine, osteopathic manipulation, functional medicine, craniosacral therapy, and medical acupuncture. He's helped top executives, Olympic athletes, top trainers, and celebrities optimize their health. Dr. Paulvin has been featured in the New York Post, Nutritious Life, Fasting MD, Ari Whitten, and many other publications and podcasts. Dr. Paulvin's practice is based in Manhattan. He also serves clients in multiple states, including Florida and California, over telemedicine. Dr. Paulvin uses traditional and alternative treatments to help his patients. Patients see Dr. Paulvin for his expertise in biohacking and health optimization. In addition, he specializes in helping his patients with hormone optimization, peptide therapy, nootropics, and natural options for pain relief, which we're going to get into today. So thanks for coming on the show. Welcome, Dr. Paulvin.
Thanks for having me. Looking forward to it.
So tell me your story. How did you get interested in regenerative medicine? I too am board certified in anti-aging, regenerative, and functional medicine. So tell me how you got interested in that.
It was kind of just the natural progression. I started doing family medicine. I did sports medicine, and then back then you started having supplements became really big, and PRP became a little bit bigger, and then I was dealing with patients also. I somehow got a lot of patients who had either chronic fatigue or fibromyalgia, and the basic stuff, traditional prescriptions just weren't cutting it.
Mm-hmm.
So I started doing deep dive into acupuncture and then to hormones, and then it just kind of, you go to more conferences and you know the same thing. You learn, oh, this works and that works. You talk to other doctors and you just kind of keep going and going. And now my practice has kind of transferred more into the more kind of cutting edge stuff, as opposed, and I mixing with some hormones is to help my patients. Still deal with a lot of the fibro patients, and I also help people who want to, I call them like the people who want to always be at 11 on a scale of 1 to 10. That's kind of like my clientele. People always aren't happy. They want to be better, which is a good thing.
I like that. I like that a lot. I've never heard that. I want to be an 11. I want to be a 12. You know?
Hey, yeah, me too.
That's great. So I would agree. And I think it's exciting, like you said, to be on the cutting edge, to be more progressive. And so I want to talk about a lot of those therapies because I think my guests are very interested in those. So one of which is peptides. And I have had some speakers in the past talk a little bit about peptides, but everyone has their own opinion in their favorite peptide. So let's talk about peptides again. Tell me what they are, and then we'll get into kind of your favorite peptides and their uses.
Sure. Peptides are most of them are small amino acids that are put together. They can be anywhere from like 9 amino acids, some are in a couple hundreds. They're different than a lot of other things out there because they can work on they're in a very special location. There's specific hormone area or specific receptor, or they can work on acting a specific pathway, like the NAD pathway. Or they just activate certain chemicals in the brain to help with either anxiety, depression, or memory. So that's why they've kind of grabbed this niche, because a lot of them have very minimal side effects, and they work pretty quickly, and they don't really interact with a lot of their medications, which is why I really like them as well. That a lot of times when I was doing traditional medicine, you'd have to give somebody a medicine for the side effect of the medicine they were already on. Like I mentioned, like things like fibromyalgia. So they could be anything from, it's exploded in the last even 3 months. It's like every week there's a new thing going on, but I've had everything from cream form to nose spray to injection to now we're doing them IV. So it runs the gamut.
Wow.
So I really like the flexibility.
I spoke on Ari Whitten Summit about hormones, and I believe you spoke on peptides, and I haven't heard that talk, so I need to go back and and watch that. That was the Superhuman Energy Summit, which is wonderful. For anyone listening, I would encourage you to check that out. So let's break down peptides into some of those categories and uses that you mentioned. So maybe starting with anxiety and depression, what peptides do you use for those symptoms?
The ones that are really out there now are, I use a lot of C-Max and C-Lank, which are both either nose sprays or injectable. They work very well. There are BPC 157 does have some activation on serotonin and dopamine, so it's usually a nice add-on. I think like BPC is definitely my favorite peptide because it's got so many different uses and really has no side effects. And then I'll combine it with something called DHHB, which is not a true peptide, but it's kind of become an adopted brother or cousin in terms of anxiety or depression. If there's any brain issues, I'll combine that with something called either cerebrolysin or dihexa. And then we always got to fix the gut. So again, that BPC 157, because we know there's definitely the causation between the gut health and the gut-brain axis and so on.
Let's talk about BPC 157 for a moment. So I first heard about that years ago, getting injected into athletes who were having injuries, and it could expedite the healing process. At least to my knowledge, that's no longer available in that form, but we do carry it at our clinic in an oral capsule version that patients can take for gut health. Is that what you're using?
I mean, I do know I inject joints.
Okay.
Patients inject it all the time.
Okay.
I'm now starting to do it a lot IV.
Wow.
I had a patient come in. I do, again, fibro patients as well as something called quinolone toxicity. They call it floxing now.
Yeah.
It's become a really incredible treatment. I mean, there's patients who 6 months ago couldn't walk, and now they've gotten IV BPC combined with something called thymus beta 4. Some people may know it as TB500.
Yeah.
And it's gotten incredible results.
So you're working with a different pharmacy than me. So you're getting it.
Yeah, I can get it. We could talk offline. I can definitely.
Absolutely.
I could hook you up with that.
So the oral version that is available, I have started using with my patients, and I've been taking it myself because its claim to fame is that it can help conditions like Crohn's and colitis and leaky gut syndrome per se. So is that one application for the oral use that you use in your practice?
I use the oral. I mean, I'm now using high dose oral. I use kind of 4 times the old school dose at this point. I also have now found a company that makes the BPC suppository. And I had a patient with UC, ulcerative colitis, who was having some bleeding, and she did the suppository for a month and a half, and the bleeding is gone.
Wow, that makes sense. Yeah. Put it right where the problem lies. That's great.
Exactly. Yeah. A to B right there. Yeah.
And if the BPC 157 is helping heal the gut, then like you said, we have to start with the gut from a mental health perspective, heal the gut, and then the anxiety and depression will improve. Well, let's go back to those nasal sprays you mentioned. So are those providing a short acting effect, or are the effects longer term? Is that something that has to be used multiple times a day?
No, it's definitely just once a day. What I tend to do is, in a perfect world, is I'll use how to explain it? Kind of a stacking dose, which the patient will do the Cmax 3 or 4 times a week, and the C-length the other 3 times a week.
Okay.
Or even give them a day off in the middle, just to see how it works, as the brain gets accommodated to it. I tend to do it. I mean, there are people who do it in perpetuity. I usually will give them a month off in between after several months of using it.
Sure.
Because if it's working, it's working. If it's not, it's not anyway. Then I'll use it, like you said, we combine it with other gut stuff, and again, I'm sure stuff you've already talked about, things like probiotics and regulating their hormones and cortisol and things like that. So, but
sure.
It's once a day at max for me, at least.
Sure. And are those peptides that can be used with medications if patients with anxiety and depression are medicated? You alluded to peptides not having a lot of interactions in the past. Can patients take the peptides also with medications that are already being prescribed?
They can. I tend to low dose them then. First of all, I got to make sure their doctor, I don't prescribe a lot of those type of medications for my patients. They're coming, they do that to another doctor. But as long as the other doctor's on board, I just tell them to go about half the dose they would be on normally.
Okay.
See how they feel, and go from there.
Sure.
So I do. They can be combined. You just got to I'd rather them go too low and then go really slow, because with serotonin, it's one thing you don't want too much serotonin. That can get them in trouble. So that's the one thing I'm a little cautious about.
Sure. You alluded to thymosin beta, and I want to talk about thymosin alpha 1 also, or thymosin beta 4, I think, and thymosin alpha 1. Peptides can be used for immune modulation, and I've only just begun really using these in some of my chronic disease patients. So let's talk about those two and break them down and their main applications.
TB4, thymosin beta 4, again, people may also, if you're in athletic field, may have heard of it as TB500. Which is a smaller fragment of it, is thymosin beta 4 is good for regulating the immune system and also boosts stem cell production. It also can increase blood flow to the area, which is why it does boost stem cell production. So it is good for boosting immunity. It's been used now with patients with hepatitis and some other gastrointestinal issues.
Right.
So that also, people were technically off-label using it as in the COVID cocktail of peptides. When this all, unfortunately, everything started in March.
Right.
So it's also great for recovery. It's great. I've used it in athletes for rotator cuff tears and things like that. But in terms of immunity, it's a nice, definitely has some utility. As I mentioned, that's the one peptide which I will right now use for about 3 or 4 months, and then have them take a break just because we don't know, because of the stem cell production. I tend to give them a break. Some doctors disagree. That the peptide was great about peptides is there's always a new one. There's no, this isn't like a Z pack or something where it's pretty textbook. Here's your pack, and I'll see you in 3 months. So it's always a learning curve. But that's the one thing in terms of thymus and alpha 1. It's like the holy grail right now. In terms of first with immunity, it just had some really good studies come out with COVID that it did help in terms of immune reaction to it. It's great. So it has been shown to, again, help hepatitis. It's been shown to boost your natural killer cells, regulate your Th1 versus Th2 ratio, Th17. So it does all the great things that you want any natural treatment to do in terms of immunity. It also has some hard studies behind it to back it up. It also has some huge anti-aging protocols, part of which is just higher dosed. It's also being done IV now. Which is great for quicker, higher boost. I mean, it's been used kind of off-label with COVID patients, IV. I think they're doing some further studies on that now. So it has a great immunity boost. I mean, I think it should be in that, along with PPC, should be in the water supply at this point. I mean, TA1 is great because it's also been already approved by the FDA. So people still get worried about things that aren't FDA approved, quote unquote. So that gives you a little bit more leeway there too.
Sure. Yeah. A previous medical doctor I interviewed on this podcast who got COVID uses peptides heavily, and he said thymosin alpha 1 was certainly part of his protocol to get better. It's something that could be taken as more of a preventative to boost your immunity so you don't get sick, or if you get sick, you can take more of it to help you recover. And just to explain to the audience, which I'm sure you can expand better on this because I have this minimal understanding of peptides, but as we age, I see a menopausal population. I like to tell my patients that the ovaries kind of shrivel up and throw in the towel, right? The ovaries don't really help so much as we age many times. When they're done, they're done. And the same is true with the thymus gland. So the thymus gland also can essentially shrivel up or atrophy. So it's not helping with immunity like it should be. And that's where these thymosin, peptides come in. So hence the name thymosin alpha 1 or thymosin beta 1. They're helping with T cell production that's supposed to be coming from the thymus gland. Do you want to expand on that at all?
A little bit. I'm trying to think how, and again, it's definitely been shown to, again, boost both antibody immunity and cell-based immunity, which is both fighting a bacterial infection and then long-term producing antibodies, which again, why it's great for everything, including COVID.
Right.
It boosts natural killer cells, will help get your body break down, for lack of a better way, help kind of eat up infection. I can't think of a better analogy than that for it. So it does all those things. So and again, like I said, it kind of gives the shriveled up thymus some help.
Yes. Yeah, exactly. So lots of applications there. It can be extremely helpful. And like you said, yeah, it'd be better to be in the water supply than fluoride and some of the other things they're putting in our water supply.
Yeah, exactly. I like that. Yep.
What about weight loss? So patients, usually as they age, body composition tends to change. So many patients want to lose weight, get that extra edge. So what peptides do you use there? I have to ask.
Weight loss is obviously always is one of those hot button topics. There's a bunch. So let's see. It depends on what the patients are looking for. So first of all, there's something called Amlexinox, which helps boost insulin sensitivity, get rid of insulin resistance. Works on the IK3 pathway. A lot of alphabet soup there to help with which helps with weight loss. It's 3 times a day. It's a pill, which people like because some people are not fans of injecting themselves. So
Sure.
People like that. There's also, you can combine that with what's called TCA cream, which is quote unquote fat loss cream.
Yep.
That's great for those people, for the love handles or something, for a local area. It's not obviously you can't put on your whole body or bathe in it, but some people would love to at some point. But that's a starting point. There's a new one out called MOT-C, which you may have talked about in some of your mitochondria stuff. But it also, because it does give improve insulin resistance, it helps with weight loss. It also helps because it boosts NAD, gives you a better workout, so you lose more calories and so on and so forth. There's also then the other big grouping is the growth hormone peptides.
Right.
And I always tell my patients it really depends what your goals are. I mean, I have athletes who want it more springtime. They want to get lean and cut and look good on the beach. The big gun there is something called testosterone. Unfortunately, it's insanely expensive right now. It's probably about $700 a month. And then the kind of below that is what's called CJC and ipamorelin, which is pretty good. It's not as strong as testosterone. And then there's a smaller fragment, something called AOD, which is good for joint pain and for weight loss. That's kind of become its niche. And that works very well. So it's usually a combination. It really depends on how aggressive patients want to be, and what's good is you can go from injection to cream to pill to whatever the patient prefers, because every patient has their own what they want. I mean,
preference. Yeah, totally. Yeah, that fat loss cream, immediately as a female, when I heard about that initially, I thought, oh, I want to try that. And I haven't yet, but that's something that can be used around the knees, right? If you're having kind of some saggy tissue there. I mean, it can be used in areas that whatever areas you would like to use it on.
Yeah.
So you alluded to NAD, so let's transition a little bit to talking about mitochondrial dysfunction. Why is that so important to, or why does it negatively impact longevity? And then we'll kind of talk about some things like NAD that can help. So what's mitochondrial dysfunction?
How long do we have at this point?
Yeah.
But yeah, mitochondrial dysfunction is pretty much, I mean, mitochondria does a lot of different things. Obviously, it's the battery part of it's your battery. It's your produces all your ATP, your energy, helps produce a lot of your proteins. It helps regulate your DNA. So all those different things are done in the mitochondria. So when it's dysfunctional, obviously it's not doing something right. Infection, inflammation, oxidative stress, which is when you have the reactive oxygen species or reactive nitrogen species cause damage. And it kind of just like it's kind of have you big a Lego set, and you kind of start breaking pieces of that Lego thing down, and it's not connected anymore. So when it's not connected, things don't work as well. So first, people will get a lot of fatigue if the energy part is not working. We're now noting that there's another part of the mitochondria called the endoplasmic reticulum, which helps make your proteins. They're now big in the last year is now something called endoplasmic reticulum stress. And we're finding there's a huge association between that and calcium buildup in the mitochondria. It makes it not work as well. So they're actually using calcium channel blockers, which is the blood pressure medicine, to block that. And we're also finding a huge association between that and like neurodegenerative diseases such as like Alzheimer's or Parkinson's. So that's an issue. And another thing you could see, I mean, you could be fatigued, you could have brain fog or memory issues. Also, like I said, there's DNA toxicity. Because you mentioned NAD. If the NAD is not produced, NAD activates certain proteins like what's called PARPs and some other things like P53 that can help get rid of some of the DNA damage and kind of recycle it. If that doesn't work, you're in trouble. So that's the short version of what can happen. There's also associated between that and diabetes. So the key is right now we're finding more and more that you talk about cholesterol and everything else. Take care of your body. You need to take care of your mitochondria because it takes care of you. So.
Yep, so true. So on past episodes, and we kind of talked about this before starting the recording today, I have talked to other guests who have mentioned their favorite mitochondrial boosting nutrients, things like carnitine and alpha-lipoic acid and N-acetylcysteine. NAD seems to be a new popular buzzword. NAD is something in the last couple of years, I know I always hear about it at anti-aging conferences, whatnot. So it sounds like that's something that you also utilize. It sounds like you do a lot of IVs in your practice. Do you offer it IV, sublingual? What's your patch form? What's your favorite way to administer that?
Honestly, it depends on the patient. If they're looking for the most bang for the buck is still IV. But if you're going to do IV now, we're finding that you need to do a stack of probably 4 times within 2 weeks at least to do it. And it could take, I go really fast. I can get it in my patients in about 2 hours. Some doctors do it over 4 or 5 hours. So I tell my patients, if you can't either don't have time to do it for 4 or 5 times, or unfortunately it's expensive to do. If you don't, then don't start. You can't dip your toe into the IV. If you're going to do it. Otherwise, there's a lot of other forms like you mentioned. My favorite besides that is probably the patch at this point. With the one caveat, I've had a couple people get allergic to the adhesive and they feel worse. But probably my second best would be the patch. Second favorite would be the patch. Otherwise, now there's these new NAD melt tabs our patients are really loving. And I also recommend all my NAD patients to do either an NAD booster or an AMPK booster, which helps produce NAD. If you're gonna do it, just do it and get the maximal benefit of it.
Sure. So I had asked one of my first guests who talked about NAD about a couple things here about the NAD IVs, and she was explaining that some of her patients get that kind of stomach flipping sensation when you're administering them that fast. Does that go away with time with consecutive IVs, or do they get that sensation with each IV?
Most patients will not happen as much. And also, when we do it that fast, if we want to, then we can give them like a Zofran, which is an anti-nausea medication.
Sure.
We just find that it works. Patients get a much bigger bang for their buck when it goes a little faster. If they can't tolerate this, we can slow play it and do the 4-hour.
Sure.
But honestly, most patients who are coming to see me for IVs, they're asking for it. Unfortunately, it's become a competition. If you read online, if you ever look at some of the groups, I did in 2 hours. No, I did an hour and 32 minutes. It's kind of like, it's almost the opposite, but no, it can cause that. And there's a couple patients who you really got to go really, really slow.
Sure. So my second concern with that, because through my training with like Dr. Ben Lynch and hearing about how you treat overmethylation, well, you can use an NAD for that. You can use, or just like niacin in general, but to treat overmethylation, my concern was that, okay, all these patients are getting pumped full of NAD. Is that actually hindering or blocking methylation? And I asked one of my past guests, and she said, I don't know. That's a good question. Well, since that time, months have passed. I have asked many people, and they said, actually, that is legitimate. That is a concern. We do want to make sure that we aren't essentially impacting methylation negatively by overuse of NAD. So what are your thoughts on that?
Exactly what you said. I mean, initially it was kind of like, and now it's become an issue. I mean, we do regulate it. I mean, we also can check if we do tell patients if they have certain overmethylation symptoms to let us know. I haven't had anybody with the issue yet. I haven't, and I know there are one or two people have had the issue. It's a theoretical possibility. I just haven't had anybody with it. I always do let the patients know, and if somebody does have like an MTHFR or one of the other mutations, I make sure they're aware of what the possibilities are.
And then we could, I suppose, I don't give NAD IVs, but I suppose you could give methylation support as well then to prevent, the impact on methylation by the NAD.
You can, yeah. I mean, you can. Most of my patients are already on some type of methylation protocol, or if they need it. You don't want to give anything the day of the IV usually, because otherwise it doesn't work as well. But you can definitely get them. If they have an issue, you can definitely give them support on the back end.
Sure. Well, let's talk a little bit about NRF2 modulators. Well, first, what is NRF2? Why do we need to know about that? Yeah.
Everybody knows about, anybody who's probably listened to your podcast knows about glutathione, how it's a great antioxidant, probably know about NAC or NAC.
Yep.
NRF2 is kind of the forgotten antioxidant cousin who may actually be better than the rest of them at this point. From my perspective, I mean, there's studies coming out in terms of how it works. It does have a kind of a brotherhood with NAD in terms of the way it's activated. Of course, now I'm forgetting the abbreviation of it's the key pathway, and there's another pathway, which of course I'm blanking on, but it's a very strong antioxidant. They're also finding now that it has anti-cancer possibilities, as well as the ability like NAD does to help any type of DNA damage. It can be taken in supplement form. There's a couple different companies that make them now. There are a little bit different combinations. Some have green tea, some have resveratrol, some have I can't pronounce it.
Sulforaphane. Yeah.
Thank you. That's what I never can say it right. And there's different combinations. I know there's a bunch of stuff coming down the pike. It was supposed to come down the pike before the pandemic. I pretty much tell all my patients who are as part of their initial mitochondrial
cocktail,
exactly, that I add that in there with some of the other things that you probably talked about in the past, and they tend to feel a little better. I mean, one of the ones where some things they don't know that they're getting better. The lab work shows it or whatever. They actually will feel a little bit more energy within a couple of weeks usually.
Wonderful. I know another antioxidant that you use that we have not yet talked about on the podcast is PQQ.
Yeah, PQQ I really liked. I didn't realize how good it was. And now there's a bunch of studies coming down the pike. Well, not the pike, they've already been released, that would combine with some of the peptides really help with oxidative stress and heal oxidative stress. It helps with mitochondrial biogenesis, which is the divide and division, the reproduction of the mitochondria. It also helps potentially fix the mitochondrial energy, what helps produce ATP is called a mitochondrial transport chain. Again, it's like a little connection of slides, as the way I try to explain it to patients. So if they're not all connected, things don't work well. It actually may heal that. It also may help with oxidative stress, which is again the damage from some we call free radicals, or they're kind of like the breakdown products that the breakdown bad guys, the breakdown bullies that you can have within your cells themselves. It's definitely part of my cocktail with another product that's called MitoQ, which also helps mitochondrial damage, and it's kind of become my go-to. I mean, literally in the last 2 months, I've seen, I think, 3 or 4 studies that show how efficacious PQQ was. And it was kind of used to be below the ones you mentioned previously, and now it's kind of jumped itself up the list a little bit.
And PQQ, sometimes for the listeners, you can find in other products. Like we have a B complex. It's from Pure Encapsulations, actually, that has, all the methylated B vitamins plus PQQ in it. Sometimes you'll find that in combination with other products. And then MitoQ, for the listeners, is coenzyme Q10. So it's a specific form, supposedly better absorbed version of CoQ10, just so they know what that MitoQ is. So I know you work with a lot of athletes. So I know you help improve mobility. So why does mobility matter? How does mobility help our health and longevity?
Mobility helps because we're finding more now that it's not just, I can't explain it. It's great that you work out and build muscle. Muscle mass is obviously very important, but if you become stiff, and then the joints themselves will become inflamed, and lack of range of motion leads to inflammation. It leads to breakdown of the muscle, which leads to potential nerve damage, and also can lead to weight gain. The more immobile you are as you get older, it can lead to things like osteoporosis, or just a joint pain in general. Also, immobility will start localized. It could be your shoulder, could be your low back from sitting on doing all your Zoom calls for the last 6 months, whatever it is. And then it's going to spread to your mid back, and then it's going to spread to your shoulders, because that's if one thing locks up, the other thing eventually has to overwork, and then it gets locked up, and so on. That affects certain things. The main things we notice now is that it can affect breathing and your diaphragm. And we know now, well, I'm sure again, most people who listen to your podcast or into diaphragmatic breathing or meditation or yoga or any of those type of things. And if that diaphragm is not moving and you're not able to get to exhale the toxins, and also will affect your vagus nerve, and which leads to all other side effects. So mobility is not just about, my shoulder, I have a little bit of shoulder pain. It could actually be things like, again, will affect your diaphragm. It could affect the nervous system. Then it'll affect your lymphatic drainage system, which will affect your body's ability to detox. So it's a snowball effect. I mean, I never did any mobility work 10 years ago. And now I do it every day. I mean, it's become a thing now. I mean, if you're on social media, everybody has a mobility workout now. And it's beneficial in terms of athletic performance. It's also beneficial in terms of your health, because it affects, again, your lymphatics. It affects your ability to detox.
So tell me about these mobility workouts. How do we improve mobility?
Improve mobility, you can do this one of 2 ways. And I recommend it depends on what your lifestyle is. I definitely recommend you probably would alternate between doing joint specific. I mean, the one I love is a program that's called KIN Stretch, K-I-N Stretch, because it's like stretching for your joints. So they have very specific mobility drills for your shoulders and your hips. I would recommend doing that once or twice a week with whatever your either foam roller, massage ball, whatever you use, and then doing a full body mobility to mobilize your fascia, cat-cow, what we call the scorpion stretch, pigeon, things like that are much more generalized things. I even have patients now that foam roll or do massage ball in their abdomen to mobilize the detox, or even I have patients who mobilize the chest muscles if they're on the younger side, to help the better that your respiratory muscles are breathing, and also stimulate your vagus nerve to keep working. So you want to mix and match that stuff.
Sure. It sounds like going to yoga could be very helpful for also just in general.
Yoga's awesome.
What about inflammation? So how does inflammation affect our health and longevity?
How
much time do you have?
Exactly. Yeah. I mean, inflammation affects everything at this point. I mean, we know it affects everything from, I mean, it's huge now in brain health. I mean, that's, again, back to BPC. We find that patients who have any type of brain issue, we get the inflammation down because of some type of blood-brain barrier issue. It's incredible. We know it affects weight gain. We know that it affects just energy levels in general. It's going to affect the mitochondria. You want to, it could be obviously from the food you eat. If you eat inflammatory foods, you're eating sugar and gluten every day. So it affects every part of your health. It could be from what you're eating, not exercising, stress obviously can boost your inflammatory levels. So that's why you want to do some combination, again, of mind body, exercise, supplementation, peptides, and kind of have that program. I mean, besides the mitochondria, controlling inflammation is one of the biggest things that you can do, and eating right in terms of affecting your health.
What are your top supplement recommendations for reducing inflammation?
I love BPC. Obviously,
Yep,
I do
yep.
high dose BPC. I love CBD, high dose.
Sure.
I love curcumin,
Yep.
which is an old school goodie. The one I really like is called Resolvins, which is a specific fish oil derivative. I know it's only I haven't used it as much lately, but I know it's made by a couple different companies. I think it was from MIT. I'm not sure who exactly. I think it was from MIT. And it's incredible. I mean, if you do it the right way, it does take a little longer. It takes about 2 or 3 months to really get the full benefit of it, but it has incredible results from everything from joint pain to like fibromyalgia patients. Those are probably my big go-tos.
So speaking of fibromyalgia, let's go back to pain. So I know you offer natural options for pain relief to your clients, and maybe you've already spewed all those out through through past questions. But when we think of pain in general, I know I'm just asking you to cut to the chase and give our listeners some tips. But what do you recommend for pain relief?
I mean, pain relief is kind of the one that part of what I just mentioned before. Those core
Yeah,
4 or
the
5 work
inflammation.
really well.
Sure.
Again, more on mind, doing a 25-minute breath work session really works well. Something I really like that I haven't brought up is red light therapy.
Yeah.
If you can either get access to a red light bed, which is probably my go-to. I mean, I'm in Manhattan, so they're one every 2 blocks. And other places in the country that patients I say I know they're not as readily available. I tell patients that they find that does help them to definitely get one at home. You don't have to get the bed. The bed's about $80,000, but you can get these portable units, which are about a couple $100. They work incredibly well. Also fix the mitochondria. Other things I like for pain is, I'm trying to think what else I haven't talked about. In terms of pain, I mean, it's really more than doing a deeper dive and seeing what else is going on. I'm trying to think.
Right. I mean, even optimizing testosterone can
That's
help
exactly what I
with
was gonna
pain
say,
because
yeah.
it helps with blood flow. So, even optimizing hormones is a piece of that puzzle.
And gut. I mean, I always will, if they have gut, any type of, always checking for like things like, SIBO or Lyme disease, but I also do a decent amount of, if their pain's not, it's always, if your pain's not going away, which 2 or 3 different types of treatments, there's probably something else going on. Check the gut, check for some type of infection. And that's usually just something that's kind of, or mold, and that's kind of the door jam preventing you from getting better.
Sure. Well, I have to ask about nootropics because that's also one of those more popular buzzwords. And, providers who are staying progressive have to know how to respond to that question when patients come in and they want nootropics. So what are your recommendations there?
There's so many now.
Yeah.
So I'll try to break down really quickly into different buckets. I mean, right now, the simple things to start with for patients who just want to dip their toe in, is like a step back. First thing you need to figure out if you want to do, is it like an ADD type person, or you're just looking to take your brain to 11? Because there's different things for different issues. But I definitely, the simple things to take are things like lion's mane is great because it's very easy to get and not insanely expensive. I really like doing something called RG3, which is a combination of ginseng, which race car drivers use or professional golfers have used for really good focus, and also decreases inflammation in the brain. So I really, that's one of my go-tos. That's have really minimal side effects to it.
And that's a compounded product, right?
Exactly.
Because I think of that as being stimulating. Is that going to cause anxiety or palpitations like caffeine would?
If somebody has either one of the genetic mutations, I've had one person who's very sensitive to it. I've not had anybody else be sensitive to it. It's possible.
Okay.
But I haven't had anybody else I start people at a lower dose and then I progress them up as needed.
Sure.
So in terms of, I mean, those are the basic one. I mean, other things that are really good is something called alpha GPC.
Mm-hmm.
That could be mixed with lion's mane, helps boost your choline levels. And then again, the other peptides we talked about, CMAX and C-Link help. And then the big gun is what's called cerebrolysin, which if it could be in the water for anybody from memory issues to unfortunate occasions of any type of traumatic brain injury, incredible nootropic.
I don't use that one. Is that an injection or how is that administered?
It's either it's an IM injection, so some patients are a little hesitant to do it. Also now it's IV.
Okay.
So it's a bigger gun.
Sure.
It's not something that you can just, again, that's not one you're dipping your toe in.
Sure.
And there's other ones. I mean, Bacopa. There's tons of other ones out there. A lot of people love whatchamacallit. I mean, exogenous ketones is another one.
Sure.
Either people who go on a keto diet will feel that they get a much more cognitive improvement. Unfortunately, patients who have Alzheimer's or some type of neurodegenerative disease, they're putting them on keto diets, and they found that their memory does improve. So that's one that you can do, either do a keto diet or do some form of exogenous ketone with like an MCT oil, C8 specific. Some people like mixing theanine with theanine. People really like phosphorylserine, which helps with adrenal metabolism, not metabolism, but excess or breakdown is really good too.
Yep. Okay. Wonderful. You flooded us with lots of information in a short period of time. And some of this may be a little over the head of some of my audience, but at least they can, take notes and go back and listen again if there's one of these peptides they want to try, whatnot. So thank you so much. I know you're in Manhattan, but it sounds like your main website is Dr. Paulvin, PAULVIN.com. And you do have a free gift on your website for listeners. So tell us what that is.
Yeah, we talked about definitely how important the mitochondria is. So you definitely can download the free energy guide. It kind of breaks down a lot of the things that we talked about, from the mitochondria to nootropics. And it's a nice little easy starter guide of the alphabet soup that we went through today.
Exactly, the alphabet soup. Well, thank you, Dr. Paulvin, for coming on the show today, talking about the nootropics and inflammation and mobility and peptides and hormones, everything that I think most of us need and we should want to learn more about. So thank you so much for providing that complex information in a more understandable fashion. So it was an honor to have you on the show. Thanks for coming on.
Thanks, it was fun. Thanks for having me.